In this video, I'm walking you through what muscle dysfunctions are and what muscle compensations are, and I will use my own body to give you an example. However, there are just some things that you need to know about what a muscle dysfunction is and what a muscle compensation is before I get onto the demonstration. And these are just really helpful for you to understand, because a lot of you that will have come into my world and started working with me and taking my programs, and you're starting to get curious about the body like butter method, you'll have come from a place where you've been treated for the location of your problem. You got specific exercises for a specific pain type, or you got exercises for a certain postural deviation, etc., etc. And one of the complete pillars of this method is that we're not treating the location, we're not treating the symptom. We will use that information to help us understand what's changing and how to work a specific exercise and whether that exercise is helping you. But essentially, the key thing that we're doing in this program is we are resolving muscle dysfunctions and releasing compensations. So usually a dysfunction is the part of your body that does not work. So dysfunction, the D, does not work. And a compensation is what changes. The C is for change. And essentially what it means is, when you ask your body to do something, if that part of your body doesn't do what you're asking, or if a specific part of your body doesn't do what you're asking, then that part is dysfunctional. Dysfunctions don't lie. In other words, if you see something when you're just standing doing nothing, and then when you put movement into your body, and if that part of your body specifically does not change and it does not lie, essentially it's a dysfunction. Okay, so it can't do what it's being asked to do. It's stuck, it's not receiving communication, it's basically like checked out. Compensations, on the other hand, are the overworked part usually. And the overworked part is the part that's supercharged. It's the one causing the symptom. It's the part that you feel is like tight and needs stretching all the time. Those are the likely parts that are compensated. However, that's not a fixed rule. The body is extraordinary. Your body needs to adapt in certain ways, and it's basically designed to survive. So this rule can change. Some of you will feel pain and symptoms in dysfunctional parts. Equally, you may feel the same in compensated parts. So let me take an example so that you can understand what a dysfunction is and how to identify it when you get into your function test. So I'm in a seated position, and when I'm relaxed, just because I know my body, and I'm just gonna tie my hair up for this, because I'm going to use my shoulders as a really good example, because they are always usually heavily compensated. I broke my left wrist when I was a child horse riding, and it severely basically caused a lot more dysfunction in my left shoulder than my right. So I'm just sitting, I'm naturally relaxed. That part's also quite hard. So I'm just naturally relaxed. And immediately, if you see, one shoulder is a little bit lower than the other. Okay, so my right shoulder is lower than my left. So what I'm trying to understand is, well, should I be doing something for my right shoulder or my left shoulder or my shoulders at all, because they don't look right? And if I'm having symptoms in the shoulder, then I want to understand, well, what's causing it? Now, all I'm going to do as a function test to determine whether my shoulder is dysfunctional or compensating is I'm just going to put my arms out. And if you look closely, this is where my shoulders were before. You can see that the right one's dropping, the right one's lower. I've even got a slight head tilt. But when I put my arms out in a T position, you can see that my shoulders are more level. It's not perfect symmetry, but they're a great deal better than when my arms are down. So what this is helping me understand is, even if I'm feeling some kind of symptoms in this part of my body, my shoulders are not dysfunctional. right? Even if they look odd, even if they have some kind of postural deviation, even if they look like, mate, your shoulders need help, as an example, when I put function in my shoulders, my shoulders seem to be doing their job. So I would determine in my body that something else in my body, and I'll give you a little bit of insight, my left ankle, lower leg, and my left foot are heavily dysfunctional due to my left bunion. They don't do their job very well, which means my left hip doesn't do its job very well. And this kind of dysfunction in my left leg always causes a compensation sort of outcome by way of my right shoulder dropping forwards, my right shoulder kind of laying low, because this left side doesn't get enough support from the base in order to do its job. So by virtue of my left leg being dysfunctional, there is a bit of a sort of knock-on dysfunction, if you like, in my left shoulder. I broke my left wrist, added dysfunction. So basically, I'm overusing and compensating in my right side. And this simple shoulder test, which is one of the tests that you will do, simply confirms this, okay? So this will hopefully help you understand that even if, and right now, ironically, I am feeling some really weird symptoms in my right shoulder, but I'm not going to necessarily treat the right shoulder as my first protocol, as my first point of doing something, or as the first sort of selection of exercises that I will do to help the symptoms in my body. What I will do is I will probably pick something that's going to help me address the left ankle, left lower leg, because that's the thing that isn't quite doing its job. Okay? So by summary, all you need to know, and it's not a hard and fast rule. If you can't identify something, it's okay. If it doesn't quite become so apparent for you, it's okay. You may have a lot of dysfunctions and a lot of compensations. What you're trying to figure out the most is what are the primary ones. And over the course of time, you may or may not figure that out in this particular program, but by practice, what you will see is that there are some really key patterns that keep kind of coming up over and over. And for me, as an example, of doing this work for like 15 years now, left ankle, lower leg, dysfunction can cause all sorts of symptoms anywhere else. As soon as I put function into my ankles, feet, lower legs, which is most humans, by the way, 99% of humans have ankle, foot, lower leg dysfunction, FYI, but most of you will have bigger sets of dysfunctions elsewhere. That you'll find that you get to these patterns. You'll find that over time, certain things will kind of like keep playing in the loop. And that's why some of you will always kind of feel certain things, or why your body kind of deviates into like a certain position. And that's why doing this work on a continuous basis will keep pulling you back into a neutral position, and it will keep preventing further sort of knock-on effect. Okay, so I hope that makes sense. Dysfunctions don't lie, and are usually the parts that are not doing their job. They're usually the parts that are deleted, for lack of a better word. And the compensations are the parts that are overworking. They can change, compensations can change, and they are often the parts that are overcharged. So that's a really nice way to think and remember what dysfunctions are and what compensations are.